The skilled admission review, what to look for before you open the MDS. Before you open the MDS for a new skilled admission, it helps to step back and understand the resident's skilled picture. Because skilled MDS is not just about completing sections, it is about understanding why the resident is skilled, what documentation should support that stay, and what information may affect the assessment. A good skilled admission review starts with one question: why is this resident here under skilled care? That sounds simple, but it matters. Are they here after a hospital stay for therapy? Are they receiving skilled nursing services? Do they have wounds, IV medications, dialysis, respiratory needs, a complex medical condition, or are there multiple skilled needs happening at the same time? Once you understand the skilled reason, the rest of the review becomes more focused. Next, look at the primary diagnosis. The primary diagnosis should connect to the skilled stay. It should help explain why the resident needs skilled services now. This is where new MDS coordinators can feel pressure because diagnosis selection affects more than one part of the process. But the goal is not to guess. The goal is to review the hospital documentation, physician documentation, therapy information, nursing needs, and facility documentation so the diagnosis picture makes sense. Then look for potential PDPM areas that need attention. You are not trying to force anything into the assessment. You are looking for conditions, services, or clinical details that are already supported in the chart and may need to be captured correctly. This could include things like certain comorbidities, swallowing concerns, cognitive status, depression indicators, isolation, wounds, IV medications, or other clinical items depending on the resident. The next thing I would look for is prior level of function. What was the resident doing before the hospital stay? Were they independent? Did they need assistance? Were they living at home? Were they already in long-term care? This helps give context for therapy, discharge planning, Section GG, and the overall skilled stay. After that, I would look at discharge planning. Even at admission, discharge planning matters. Is the goal to return home, return to assisted living, stay long-term? Is family involved? Are there barriers? Discharge planning can affect meetings, therapy goals, GG discharge planning, and the way the team communicates about the stay. Then I would look for documentation gaps. Is the skilled need clear? Are orders in place? Is therapy involved if therapy is part of the reason? Are nursing services documented? Are there diagnoses that need clarification? Are there items that should be followed up with the IDT before the ARD? This is why skilled admission review is so important. It gives you a roadmap. You're not just opening an MDS and hoping you find everything later. You're starting with a clearer picture of the resident's skilled stay. So before you open the MDS, pause and ask, why is this resident skilled? What diagnosis supports the stay? What PDPM areas may need review? What was their prior level of function? What is the discharge plan? And what documentation needs follow-up? That kind of review can make the MDS process more organized, more accurate, and much less reactive. If you're looking for tools and resources to aid you on your MDS journey, check out our shop at 5starmdsnavigator.gumroad.com or come see us on Etsy at 5 Star Navigator.